Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is called joint pain caused by obesity. As we know that obesity is a pandemic at this stage and is a very concerning chronic health condition, and I have spoken a lot about it in my previous podcast, but today I'm only going to talk about one of the complications of obesity, which is joint pain caused by obesity. And again, I'm going to take you through an essay that I have got in front of me, and we will read it together. So, joint pain caused by obesity, a medical perspective. Obesity is a growing global health concern affecting millions of individuals and contributing to a myriad of health complications. One of the significant health issues arising from obesity is joint pain. Which joints though? Particularly in weight-bearing joints such as the knees, hips, and lower back, because these are the places, or these are the joints that actually bear the weight of a person. This essay will explore the relationship between obesity and joint pain, the underlying mechanism, the impact on quality of life, and potential management strategies. Pathophysiology. What is pathophysiology of joint pain in obesity? Like, how do you get joint pain in obesity? The connection between obesity and joint pain can be attributed to several factors. First, excess body weight places additional mechanical stress on joints, particularly those that bear weight. For instance, each pound of body weight exerts approximately 4 pounds of pressure on the knees during activities like walking. So again, I would like to tell you that each pound of body weight exerts 4 pounds of pressure on the knee joints during activities like walking. This increased load can lead to the degeneration of cartilage, the protective tissue that cushions joints, resulting in osteoarthritis. So the cartilage that is cushioning the bone surfaces, that actually gets worn down, and then it all results in osteoarthritis. In addition to mechanical stress, obesity is associated with the state of chronic low-grade inflammation. Adipose tissue, which is body fat, secretes pro-inflammatory cytokines or chemicals, which can contribute to the degradation of joint tissues. So see, this is very, very important. I don't think I have spoken about it earlier. So obesity or high BMI or weight can actually cause chronic inflammation, chronic low-grade inflammation in the body. How interesting is that? What happens is that the tissue fat or adipose tissue or body fat actually releases pro-inflammatory chemicals called cytokines, which can contribute to the degradation of joint tissues. So first is that the mechanical stress actually degrades or damages the cartilage. Number two is that the inflammatory effect of obesity actually degrades the joint tissue. This inflammatory response exacerbates pain and can lead to further joint damage over time. Very, very interesting to know, isn't it? Quality of life considerations. Joint pain can significantly impair physical function, reducing mobility and impacting daily activities. Individuals with obesity often experience limitations that can lead to a sedentary lifestyle. And again, this is a vicious circle. So the more you can't move, the more you will be sedentary and the more you will put on weight, creating a vicious cycle where reduced activity leads to further weight gain and increased pain. So the more you gain weight, the more inflammatory response and the more pain. This cycle not only affects physical health, but also has psychological implications, including low self-esteem and depression. Management strategies. As we know that addressing joint pain associated with obesity requires a multifaceted approach. Weight loss is one of the most effective strategies for alleviating joint pain. Studies have shown that even modest weight reduction can lead to significant improvements in pain and function. Lifestyle modifications, including dietary changes and increased physical activity, are essential components of weight management. But again, the problem is that physical activity can be limited with pain. So pain management and obesity management with the help of medications can be very, very helpful here. Physical therapy can be beneficial, like physiotherapy, helping to strengthen the muscles around the joints, improve flexibility, and enhance overall function. In cases where conservative measurements are insufficient, medical interventions such as pain management medication or surgical options may be considered. So, the relationship between obesity and joint pain is complex and multifaceted, multifactorial. Understanding the underlying mechanism can inform effective management strategies aimed at improving patient outcomes. As obesity rates continue to rise globally, addressing this issue is critical not only for reducing joint pain but also for enhancing overall health and quality of life. See you guys next time.